How can I tell if I might have obstructive sleep apnea or not? What could be the common signs and symptoms for a layman to understand about it?
So, if a person, so let's just divide it into for children and for adults. If you have an adult and the person is snoring, as soon as the person hits the bed, irrespective of what position they are in, that is a red flag for us. This basically tells us that the patient has, or the person basically has, impaired breathing, either because of some obstruction that is happening in the upper airway, or because of some kind of a block happening in the upper airway, making it hard for that person to breathe. Whenever there is this kind of a scenario in the patient or in the person's upper airway, it becomes difficult to breathe, and hence they manifest in the form of snoring. The second cardinal sign that you should be looking for is what we in textbooks are called as witnessed apneas. Means when a person is asleep and the person is snoring, if the air is not going through the upper airway and the person is actually choking, what you would see is that there will be a pause in the breathing, and the snoring which was there would stop, but there will be a lot of effort that the sleeping partner would visualize when the person is breathing. In the sense, there will be an increased work of breathing. That means the chest and the abdominal movements would vary, but there wouldn't be any air that's coming from the nose and the mouth. That is telling us that the person is actually choking. That is the second red flag. The third red flag for an adult is actually getting up multiple times in the middle of the night. A lot of conditions can cause this, but one of the most important conditions that makes a person wake up in the middle of the night to pass urine is a condition called nocturnal enuresis. So nocturnal enuresis means in the sleep they're waking up to pass urine, and that's another flag for obstructive sleep apnea. These are the cardinal 3 or 4 symptoms where a sleeping partner can actually pick up and say that this person is not breathing properly during their sleep.